Now, Omicron BA2 is occurring about 4%, maybe 5% of cases now in the United States, and is occurring throughout the United States. And in the UK, it's probably 5 or 6% of the cases. So we need to know a bit more about Omicron BA2 as opposed to Omicron BA1. And of course, as always, the Danes are way ahead of the game on this. So let's look at some Danish data here. This is from the State Serum Institute in Denmark, which is the world-leading genomic institute, basically. They have been ahead of the curve on this. Omicron SARS coronavirus 2 variants quickly become dominant, of course, significantly higher growth rate than Delta. Omicron variant is more transmissible than the Delta variant, all this we know. Now, it's looking like BA2, which is the new form of the Omicron, or the one that's becoming more prevalent now, is more infectious than the BA1. So the secondary attack rate, when one person in a household was infected, how likely was it that other people in the household became infected? Then with BA1, it was 29% of people became infected in the household. With BA2, it was 39%. So that is showing a greater level of infectivity with BA2 as opposed to BA1. Which is why it is now BA2 is 100% of cases in Denmark. And it's shown reducing sensitivity to neutralising antibodies, but as we've seen, if you've had BA1, you will be immune from BA2 to all practical purposes. Vaccine-induced protection against infection is also clearly reduced for the Omicron compared to the Delta variant. We know that. But we also know that natural immunity gives very high levels of immunity even in people that are unvaccinated. So if people have been unvaccinated and they've had the infection, but they're lucky enough not to get very sick and survive, then they have good levels of immunity and good levels of protection against reinfection and against hospitalisation and deaths. And from the data from New York and California, they have a greater level of protection than people that are doubly vaccinated. Transmissibility is lower in fully vaccinated individuals, even lower in boosted vaccinated individuals compared to unvaccinated is the Danish data. So they're certainly seeing advantage from vaccine, of course, but that is not comparing it to those that are unvaccinated and have had the infection. That data's not there, and it's disappointing to see that data's not being provided clearly in any updates from the CDC or indeed by the Office of National Statistics in the UK. What we want to know, we want to compare the infection and the reinfection and the hospitalisation in people that are unvaccinated but have had the infection with people that are vaccinated, because the early data is showing that the natural immunity is even better. Of course, if you've got both, if you've had the infection then vaccinated, or vaccinated and had the infection, you've also got very high levels of immunity, this so-called hybrid immunity. So preliminary analysis, 36 to 80% risk reduction in hospitalisations for the Omicron compared to Delta. Roughly what we're seeing in the UK, towards the higher end of that. With most studies reporting a risk reduction of between 45 and 68%. Again, in the UK, we're seeing round about that level of protection overall. Now, the Omicron, it's important to remember that there's actually several sublineages of Omicron. Now, I think I've actually got a graphic here that shows this. It's really quite strange. So here we have Omicron here. We see it has not come from Delta. It's come from the original, this is the original wild type strain here. So Omicron's come straight from that. And where it's been all this time is hard to say. It could well be that it's been in mice. So basically we don't know. And I haven't seen any updated literature on that. But if we get it, we'll obviously cover it. But anyway, this shows there's different lineages of Omicron. And we can see that there from this, there's different bits to it there, different lineages of Omicron. So there's these different ones, BA11, 529, BA1, BA2, BA3, BA. So there's different lineages of it. You would expect this because it's constantly mutating. And these account for 97% of Omicron cases worldwide. Now in Denmark, in week 52, the BA2 was 20%. And by week 3, so that's 3 weeks later, BA2 was 60%. So it's massively increased. Doubling time of about 6, or it might give us the doubling time, about 6 or 7 days in the Danish situation. The doubling time in the UK seems to be quite a bit slower than that, probably nearer 11 days to 12 days. An increase in the proportion of BA2 and a decrease in the proportion of BA1, so the BA2 being more transmissible is gradually replacing the BA1. BA2 is probably beginning to take over in India, the Philippines and some European countries, and Qatar also is now BA2 dominant. So increasing growth potential, that's for sure. So if it's increasing growth potential, it's becoming more prevalent, that can be caused by higher transmissibility and or the ability to escape the immune system compared to BA1. But we've now seen that the BA1, if you're infected with BA1, you are getting good protection against BA2. So that means the increase in prevalence of BA2 compared to BA1 is almost certainly due to the increased transmissibility. But of course, the vital question is, does it make us sicker? Current knowledge about severity, no difference in hospital admission risk was detected for BA1 and BA2 from 932 hospitalised patients. The difference was, though, that BA1, the median age of hospitalisation was 51, and BA2, the median age of hospitalisation was 40. But of course, younger people do better than older people in general, and this is carried on being true. So younger people being hospitalised with BA2, but no difference in hospital admission risk and no difference in deaths were detected. So if anything, the BA2 is a good thing because it's increasing transmissibility. People are getting infected more quickly. The disease is remaining mild in the majority of cases, and of course this is generating much higher levels of natural immunity. As long as hospitalizations can be kept down, because everyone's going to be exposed to this anyway, it's quite reasonable to argue that this is a good thing. Although the authorities are still saying to minimise contacts if we have the infection, but that's just the way I see it. Omicron is generating huge amounts of natural immunity. The other question I am asked quite a bit is, if BA2 is more transmissible than BA1, why didn't we have the BA2 first? Why wasn't the BA2 there from the beginning? Why didn't it out and compete BA1 to begin with? And the answer is it wasn't there. So the BA1 came along and started multiplying first and thankfully replaced the Delta. And now the BA2 has come along and is starting to replace the BA1. Had the BA2 been there at the beginning, it would have become the more prevalent strain straight away. So the BA1 was there first, and this is called founder effect. And the analogy I've used before, it's a bit like saying, why was there no white European people in Australia 1,000 years before Christ? And the answer is because they hadn't arrived there yet, so they couldn't reproduce. It was the indigenous Australians that were there, therefore they were the ones that were populating it. And then when white people came, they started reproducing there as well. It's exactly the same as that. Well known in evolution, it's called founder effect. But now the BA2 is taking over, so I'm expecting the main endemic virus, the main endemic SARS coronavirus 2 to be Omicron BA2, probably for some time to come. Thank you for watching.